Hi everyone and welcome to week 9. My name is Tasha and together with Amanda, Carlene, and Mary, we will be facilitating this course congress on the subject of precepting, collaborating with, or mentoring someone who struggles. In this video debrief learning activity, you will be presented with a practice scenario of mentoring a nurse who struggled. Precepting or mentoring can present their challenges and do not always turn out the way that we hope they will, despite our best efforts. Here's the scenario. You are precepting a profession-level nurse who was newly hired and has been paired with you for several orientation shifts. The nurse states that she has been practicing as a registered nurse for 5 years and has significant emergency room experience and holds a certification as an advanced cardiac life support provider. Over the course of these shifts, you notice that the nurse is struggling to prioritize the sickest patient first, to initiate intravenous lines, and to administer medications. You discuss your concerns with the nurse privately, review process, and practice skills with the nurse, who nods her head and states that she understands and is just feeling nervous and will work towards practicing more safely and independently. However, your expert precepting senses tell you that something is still not right, and you refer the nurse to the clinical nurse educator, who provides her with further education. Several months pass by now, and this nurse is now working independently in the emergency department and is your partner for the shift. You've heard several negative comments from your coworkers regarding the nurse's professional abilities, but choose to keep an open mind and start the shift off on a clean slate. Throughout the shift, the nurse continues to struggle with initiating intravenous lines, is unable to locate several medications, cannot follow process, and is visibly frustrating the on-call physician. Then, during a code, you were delivering compressions to a patient and asked the nurse to attach defibrillator pads to the patient and life pack. The nurse struggles with the pads for approximately 20 seconds before admitting she does not know how to connect the defibrillator pads to the patient or the life pack. At this time, you must stop delivering compressions to apply the pads to the patient and connect them to the life pack yourself. You discuss your concerns with the nurse privately, who states, "It's not a big deal. You knew how to do it." You feel frustrated and recognize that this nurse has jeopardized patient safety. After you finish your shift, as a last resort, you reapproach the clinical nurse educator to clarify whether or not this is a practice issue that can be addressed by further education. The clinical nurse educator admits that she spent several hours working with this nurse and that the nurse has also received several extra orientation shifts. Recognizing that patient safety is in jeopardy, you approach your manager and discuss your concerns. Your manager affirms that several of your coworkers have come forward with similar concerns and asks you to document yours so that she may proceed to terminate the nurse's employment. Several theories exist to guide mentors and preceptors as they attempt to support someone who is struggling. Please bear this in mind when you complete this video learning activity, as it will assist you in completing learning activity number 2, linking theory to practice. Now head over to the video debrief forum and consider the scenario in the video. Reflect on a time that you encountered a preceptee or mentee who was struggling and explain what you did to assist them, the challenges you experienced, and how it turned out. You are invited to share your responses in the video or written format. Make a note of this learning activity in your personal learning journal. We look forward to your responses. Bye-bye.